In addition to the significant immune modulation capability of fibroblasts, they're also only one of two types of cells in the human body that can differentiate into other cell types. For our degenerative disc disease clinical indication, we're focusing on both of these characteristics of fibroblasts, not only to repair the damaged cartilage tissue, but also to replace the damaged tissue with fibroblasts that differentiate into chondrocytes and chondrocyte-like cells that secrete collagen and proteoglycans to replace the damaged cartilage. And currently, the immune modulation capability of fibroblasts will reduce the localized inflammation and pain, thereby reducing the dependence on pain medication and steroids for inflammation and pain control.